So last Friday after work, I was walking out. To be honest, I was walking out of a liquor store near my office, getting some drinks for the weekend. And right now, near the liquor store where I was coming out of is an urgent care center. And I saw a provider, I think it was a provider, in a white Tyvek suit that you might wear to clear out asbestos from your house, and goggles. And she was examining a woman in the front seat of her car. And the woman was fully clothed with actually a nice warm sweater on because it was cold that night. And she was listening with a stethoscope through her sweater. And I actually stopped. I had, my hard seltzer in one hand and something else in my other hand. I stopped and I said, "I'm sorry, but do you think you can get a good lung exam listening through the sweater to the provider?" And the provider looked at me not happily. I said, "That's a joke," and I kept on walking.
Yeah.
I pride myself in my office on the care that we deliver and the continuity of care that we deliver, and providing what we call a medical home to our patients, right? That we can give them whatever they need, hopefully. But as you and I know, urgent care provides a different kind of care to people, and especially different kinds of cares depending on where you live in the country. And it's not always the best care. It's not always optimal care. And
was that urgent care affiliated with any teaching hospital?
Standalone urgent care. And they're around. And they serve a purpose. I get it. But what frustrates me is sometimes the care that's being given, the quality is low. And I know providers that work at these places, and it interests me that sometimes when they go work there, their ability to provide good care seems to drop. And I do think there is more of a financial incentive there versus a quality of care, being delivered at a high level, and it just frustrates me.
Well, probably that urgent care is one of the many which is part of franchise. And if you've been to Orlando, I drove through Orlando and there are a bunch of these, right? I think it takes like $1 or $1.5 million to get a franchise. And it is frustrating because I feel like these facilities are also targeting people who may not really have the resource, but they're desperate, right? They don't have insurance, or maybe lack of green card or whatever, but the care sucks.
Yeah, especially in areas like that. Yeah.
And if it's franchise, then the goal is to make money.
Yep.
So there has to be profit. And I went to one of those because one of my kids and, little one needed something, but it's like pitiful.
You should have called me. I would have come down.
I know. I should have. I didn't know you were around that.
Yeah, down in Florida. About a year ago, I had a father come to my office on a Saturday, and I said, asked him why he was here with his son. He said, "Well, I think he has an ear infection." I said, "What makes you think he has an ear infection?" Just wondering, what are the symptoms? He goes, "Well, he's the same symptoms that I do, and I went to urgent care this morning, and I have an ear infection." I said, "Oh, mind if I take a peek?" Because you don't often see adults with ear infections.
Yeah.
So he'd just been there an hour before, and I looked in his ears, and I said, "I got to be honest with you. I'm sorry. Sometimes it can be a subjective call sometimes, but your ears look perfect to me, as do your son's." And he just came from urgent care.
Yeah.
So one thing is they'll never see him again.
Yeah.
Right? He goes in there, they diagnose him, they treat him, he's gone. They have no one to answer to.
Yeah.
Every day I look in ears, and every day I don't want to overcall or undercall an ear infection. And I've seen ears change, and I don't want to overuse antibiotics. I want to use them when appropriate. But, I don't know about you, but I think hard and fast about every decision I make in the office in terms of how I treat someone, whether it's dosing Tylenol, whether it's giving steroids for poison ivy or asthma or antibiotics. Like, when do I use them appropriately? Hopefully always. And what's the decision-making process? And I think that's lacking too in these urgent care centers. They have no one to answer to.
I wonder how much money they made during the pandemic.
So
tons.
So it's interesting because I don't have the numbers on that, but when the pandemic started, they were losing tons of money because, and I know people that worked at urgent care centers in the area, and they were being laid off because no one was going in there, because even if you went in there, you couldn't get tested, right? There was no COVID. So whatever symptoms you had, unless you were really sick, you were going to go to the emergency room. And they were losing a lot of money. And then when the testing came out, they actually were the places that were getting, they had priority to get testing kits, like for the rapid testing. So they started making lots of money.
I went to one of those.
Yeah.
Jeez.
Should have came to me.
I should have.
So I think they're doing fine now. I think that we have to, as we come out of the pandemic, hope people will. We still see a lot of patients in our office, but I think people need to adjust their care expectations and come back to the primary care offices. Although, just to mention, during the time of COVID, a lot of primary care offices were not seeing patients for fear of getting COVID in their office and losing staff and being able to work. So that's where urgent cares came in, or emergency rooms came in. But most offices now are well equipped to handle, sick kids, sick adults, sick patients, as they did in the past.